10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
We make a real big difference. We know that because that's what people tell us. And actually we're adding years to life.
They encourage you to do as much as you can.
Quite simply, it can be having that time with someone and saying, actually, I would quite like to get out in the community, but I'm lacking the confidence.
The Kingston Health and Care Plan brings together all the different aspects of health and care, which no one organisation can do by themselves. This plan's about our local NHS, the council, voluntary sector and community sector working as a whole system to improve health and care together. Our plan identifies priorities and actions for the children of our borough to start well, for adults to live well and for people to age well. We've also identified actions to take so that carers are supported and for prevention to be championed across all ages. These actions have been endorsed by local people, the voluntary and community sector and professionals across the health and care system.
I am a huge fan of the Daily Mile. It's a fantastic national initiative that aims to get more children out of the classroom and walking, jogging or running for 15 minutes a day. We know that nationally about a third of children are overweight, and that's a local issue for us too. That's why our local health and care plan has a specific priority about reducing childhood obesity. We know that the Daily Mile has huge benefits. It helps children become fitter, helps them to maintain a healthy weight, and it also boosts their concentration in the classroom too. That's why I am a huge fan of the Daily Mile, and I'm so pleased that schools in our borough are contributing towards it.
We are Youth Out Loud!
I joined Youth Out Loud because I'm very passionate about changing and possibly learning more about the way the health system works in our local area.
It felt really good that we were given a voice in this project because we feel like young people need to be listened to in all aspects that affect them, especially ones around their health.
Youth Out Loud is also involved in the Digital Youth Project, which is running in both Kingston and Richmond boroughs. We're working with Achieving for Children to make some films to help young people find information they can be signposted to for various mental health issues such as self-harm.
Kingston is our system-wide approach to social prescribing, and we've been working in partnership with our local partners in Kingston and our local communities to develop community champions who are our workforce, who have positive conversations with people about changing their behaviours or enabling them to link with their local communities to help them to be socially connected.
About a third of people are possibly going to the GP when the root of their ill health or malaise is actually a social reason. And the GP in their consultation time isn't always able to address those issues. They can address very well, obviously, the medical issues. So it's really giving people some support to have some time to express those needs and those concerns, and then some support to access things in the community that can help them.
One of the priorities of the Kingston Health and Care Plan is making sure people with a learning disability have the same opportunities as everybody else. It's really important for people with a learning disability to get their annual health check with their GP, because sometimes people with learning disabilities have more complex health needs than other people. So having an annual health check, you can pick up any issues before they become a problem.
Prevention needs to be across the life course, starting well from babies through to the age of 19, living well for adults and ageing well for older people, enabling people to access the services that they need when they need them, smoking cessation, stopping smoking, helping people to reduce the amount of alcohol they drink, eating healthily, maintaining a healthy weight and keeping physically active.
It's really important that things like the Kingston Health and Care Plan addresses things like loneliness, because it's a huge issue here in Kingston, as it is everywhere else. We know for a fact that people being lonely really affects their health. We've done lots of initiatives around isolation and loneliness. Here we're sat inside Raleigh House. We find that people enjoy the days here, they come here because they choose to come here, and we make a real big difference. We know that because that's what people tell us.
I recently come to Raleigh House, and because I was broken my arm and I can't move, I have been having carer, although they're coming every morning, but still it's not enough for me. I'm joy to come to Raleigh House because you meet people and then you got a lot of things to stimulate your brain to do.
I came to the day centre on the advice of my doctor because I was very low-spirited following the death of my wife, because we were very close. I suppose this happens to lots of people when they lose someone. I was so lonely, I couldn't believe it could be so lonely. As soon as I get through that front door, I start to get a lift. It floods out of me and I can feel similar to like someone is going to love me, to greet me with lots of love. I blossom, I actually feel great, and I start making jokes with the staff and everything. That's what I have, and that's what I've noticed here. I hope everybody feels the same. The staff are fantastic.
Kingston Carers Network is an organisation that supports unpaid carers in Kingston. Carers should be a priority because they save the economy so much. They're thought to contribute about £200 million worth of care each year. So without carers, we just couldn't manage. There are a number of challenges for carers. A lot of carers have to reduce the amount of work they do. And if we're looking at young carers, they're more likely to have emotional health problems. We need to make sure every carer is aware of services, where they can get support, what their rights are.
We hope you have enjoyed hearing a little bit about our health and care plan. You can read more about it on our website.